Now coming to the description of the interior of the rectum. There are two types of mucous folds within the rectum. Some are temporary and some are permanent. Temporary folds are mostly longitudinal in direction, situated in the lower part of rectum and disappear when the organ is distended. We will focus mostly on the permanent mucous folds, which are known as Houston's valves. They are horizontally disposed, semilunar in shape and situated along the concavities of the lateral curves of the rectum. Each valve is formed by reduplication of mucous membrane containing submucous tissue and thickening of circular muscle of rectum. Some valves contain, in addition, inward projection of the longitudinal muscle. Now, according to Houston, the valves are 4 and numbered from above downwards. Out of these, first and third valves are constant, second and fourth valves are inconstant. Let us see them one by one. However, in this specimen, had it been a freshly cut specimen, all the valves would have been very prominent, but in this case, only the third valve, which is the most important and constant of the rectal valves, can be clearly made out. But for the sake of understanding, we will go through all the valves one by one. The first valve is situated close to the rectosigmoid junction opposite S3 vertebra and lies about 12 to 14 centimeters above the anal opening. It arises from the right or left side of the gut. Second valve is situated about 2.5 centimeters above the third valve and arises from the left wall of rectum along the concavity of the upper lateral valve curve. Third valve is the most important and constant of the rectal valves. It arises from the anterior and right wall of the rectum along the concavity of the middle lateral curve. Sometimes the valve encircles the rectum. In such a case, the circular muscle of the valve is known as Nelaton's sphincter. Now the third valve is situated opposite S5, about 5 centimeters above the anus, just above the rectal ampulla, where the peritoneum is reflected from the rectum to the adjoining vessel. The third valve divides the interior of rectum into upper and lower chambers, which are different in development and in functions. The upper chamber is developed from the pre-allantoic part of the hindgut, whereas the lower chamber is developed from the post-allantoic part of the cloaca. Functionally, upper chamber may contain feces without the reflex act of defecation, but when feces appear in the lower chamber, defecation starts spontaneously. The rectum is sensitive to differentiate by presence of feces or fletus in its interior by the degree of distension. The fourth valve, again an inconstant valve, not very well defined in this specimen, is situated about 2.5 centimeters below the third valve, arises from the left wall of rectum along the concavity of the lower lateral curve. Now a word or two on the importance of the Houston's valves. A. Rectal valves support the weight of feces, particularly in man who assume upright posture. The valves prevent passage of instrument from anus unless carefully passed. The cannula for rectal washing is usually passed in left lateral position of the patient to avoid injury of the Houston's third rectal valve and for easy access to the sigmoid colon. So, with this we will end our discussion on the rectum.